50% of surveyed Americans report that they know or have previously known someone who's addicted to pain relievers. It's a lot of people.
Half of us know someone affected, yet the stigma remains a big issue. Stigma for the person addicted, stigma for their families, stigma for the evidence-based treatment that is saving lives.
And I think so often, families act ashamed of it. And if they act ashamed of it, what they accomplish is they reinforce the stigma of it. And if they reinforce the stigma of it, they're on the other side of public health, because stigma has no place in public health.
One of the most powerful ways to confront stigma is to speak out, to share our truth with others. And that's what CDC Director Dr. Robert Redfield is doing. A married father of 6, his son became addicted to opioids.
I really thought I probably was an expert, but I tell you, I had no concept of addiction until it entered my own family. And, we have a great family, but I can tell you it almost ripped our family apart. I didn't realize that addiction is not a medical condition that confronts the individual only. It's definitely a family community medical illness that we're confronting.
Information in health in America.
One of the gifts of being a doctor, if you really get into it, your patients become your friends, and you kind of learn more. I guess that's why I was shocked that I didn't quite understand this until it really entered my own family, because I really wish I understood what I did now. I would have probably been a better doctor to all of them.
He found himself in the all-too-common, frustrating position of trying to get his son help that would work, that would save him.
When I was looking for my own family member, tried to look at programs records, what was their percentage of treatment success? Well, you can't find it. I want to know their methods of treatment. I want to know what their outcomes are. We love our child that got involved in this dearly. It was a great gift. I'm happy he's 4 years from recovery now. I think it's a great gift that he was able to decide to accept treatment and go into recovery. But we would go to gatherings and, no one would talk about addiction. And then my wife would make some comment about our son's journey. And then about 5 minutes later, a couple would cross over to come talk to us and say their son just overdosed. And then, 10 minutes later, somebody else would say their son's still struggling, they don't know how to get it. Before the dinner was over, 50% of the people that were at this room were struggling with addiction somewhere in their family.
Redfield says the importance of medication-assisted treatment wouldn't exclude support programs or counseling, but it's an evidence-based way to get help.
I can tell you that if you go into a safe syringe exchange program, you're 3 to 5 times more likely to go into treatment for your addiction. I want people to go into treatment for addiction.
As for the opioid crisis in Georgia,
the challenge with Georgia, it's very diffuse. Some people may want to think that the biggest problems are in the urban areas like Atlanta. The truth is, much of the problem is actually out in the rural counties. Here in Georgia, you have certain counties that have received 50 million tablets of oxycodone for a county, enough to treat every single man, woman, and child in the county.
Redfield says the prescription monitoring programs have cut opioid prescriptions by 60%.
I think we have to say it the way it is. The bottom line is the prescription for an opioid is one of the most critical decisions a provider would make. I didn't know this as a provider until I became CDC Director, that the risk of long-term addiction to opioids was 2 to 6% from a single prescription.
Redfield says the CDC is notified of all drug overdose deaths across the country within 48 hours, and non-fatal overdose data is gathered weekly.
When I became CDC Director and I was looking at data that was 2 years old, it's going to take us a while. But I had no question we're going to get out of it. And ultimately, science is going to get us out of it. But in the interim, we have to use the tools we have now to the best of our ability. But we can't lose sight of the possible.
Those words come from experience as a scientist, physician, and father.
My wife and I just broke down in tears maybe 16, 18 months after he was in recovery, when he called one day and he said, you got your son back.
For thousands across the country and in our communities, the price of this crisis has been too high, the losses too deep. But resilience
You have to have the advocacy, the education, and the prevention.
and resolve
We support all pathways to recovery.
are driving forces in making sure this doesn't happen to others. Institutions linking arms, translating the science, breaking down barriers to treatment.
I got sober in December of 2006.
People sharing their stories.
I can do a lot of stuff that I didn't think I was able to do. So, that's kind of how I feel.
Getting rid of stigma.
It is a community with a lot of needs, but it's also a community with a lot of heart.
The goal, quite simply, is this.
It is.
Intact families on the other side.
Our life will never be the same, but that's not a bad thing.